Folic acid is a man-made form of folate, which is a B vitamin found in some foods. It is important for forming healthy cells, especially red blood cells. Folic acid supplements, which may come in different forms, are used to treat or prevent low folate levels. Low folate levels can lead to certain types of anemia, and can be caused by various conditions such as poor diet, pregnancy, alcoholism, liver disease, stomach/intestinal problems, kidney dialysis, among others. It's important for women of childbearing age to get enough folic acid, either through their diet or supplements, to prevent birth defects in their babies. As for the daily dosage, it's best to consult with a healthcare professional, and the optimal timing to take this medication is usually once a day. When taking Fa-8, it's important to follow the instructions given by your doctor or pharmacist. Typically, it is taken once daily, with or without food. The dosage will depend on your medical condition and how you respond to the treatment, so it's crucial not to increase the dose or take it more frequently than directed. To get the most benefit from Fa-8, it should be taken regularly at the same time each day. It's also recommended to follow a diet plan as advised by your doctor or dietitian. If your condition does not improve or worsens, or if you suspect a serious medical issue, seek medical assistance immediately. Folic acid typically has very few side effects. If you experience any unusual effects, make sure to inform your doctor or pharmacist right away. If your doctor has recommended this product, it means that they have determined that the benefits outweigh the potential risks. Most people who use this product do not experience serious side effects. Although it is rare, a very serious allergic reaction to this drug can occur. Seek immediate medical help if you notice symptoms such as rash, itching/swelling, dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice any other effects not mentioned, be sure to reach out to your doctor or pharmacist. In the US and Canada, contact your doctor for medical advice about any side effects. You can also report side effects to the relevant health authorities. Before taking Fa-8, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of vitamin B12 deficiency. It's also important to inform your doctor or dentist about all the medications and supplements you are taking before any surgery. Fa-8 is safe to take during pregnancy and is often included in prenatal vitamins to prevent certain birth defects. It can also pass into breast milk but is unlikely to harm a nursing infant. It's always best to consult your doctor before taking Fa-8 while breastfeeding. When taking Fa-8, it is important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It is important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. It is crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Fa-8. As for the recommended daily dosage and optimal timing, it is best to follow your doctor's instructions. They will be able to provide personalized guidance based on your individual needs and health condition. If someone takes too much Fa-8 and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 or the local poison control center immediately. In the US, the number for the Poison Control Center is 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include mental or mood changes. Remember, never share your medication with others. It's important to have regular medical tests while taking Fa-8, including a complete blood count, folate blood level, and vitamin B12 blood level. Make sure to keep all of your medical and lab appointments and consult your doctor for more information. Folate can be found naturally in leafy green vegetables, organ meats like liver and kidney, as well as citrus fruits. Folic acid is also added to enriched grain products such as bread, pasta, and cereal. If you're looking to increase your folate/folic acid intake, consult your doctor or a dietitian for a plan that suits your needs. If you forget to take a dose of Fa-8, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take double the dose to make up for the missed one. Remember to store Fa-8 at room temperature, away from light and moisture, and not in the bathroom. Keep all medications away from children and pets. Do not flush Fa-8 down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.